And we're live, I guess, with that. So first, let me just say thanks to Joe and to Jim and all of the IT staff for setting all of this up for us. Really, this is a great opportunity for us to connect with all of you to improve the flow of communication. And we're really appreciative of having this technology in place. Hopefully, all of you find it useful as well. So we will welcome your feedback at the end. I think it's been particularly beneficial for us because we have the opportunity to engage with all of the departments individually. And we found as this whole situation is evolving that as much as we try to communicate things organization-wide, I don't have to tell this group that, that things are sometimes different depending on what department we're talking to. And so unfortunately, not all of the messages can be consistent across each department. And so rather than trying to communicate things in writing with a lot of different caveats or exceptions or nuances to the message, it's really great to just have the chance to interact with all of the individual departments. And so I know how busy all of you are, and so thank you for all those who are participating. I can't see who's on the call, but I presume that you guys are out there, and so for everyone taking time out of their day or on their shift, thank you guys very much for being here. And so again, the intent of doing these sort of Q&As is just that, to address any topics that you may be worried about. My sense or my intent here is to try to address a few topics in the beginning that I know are questions we've been getting from a lot of other groups or that I might expect you guys to have questions on. I will try to provide that information in the beginning to head off or to save time for some of the Q&A portions that will come after that. But I will say that please know, because this is such an unprecedented time and because a lot of this is evolving not just day by day, but really hour by hour, I will ask for a little bit of patience for everybody and recognizing we may not be able to answer every question today because we may just not have an answer for it yet, but know that we are continuing to work on all of the issues that are out there. It is a fluid situation, but if I can't answer or Peter Deshay can't answer a question today, know we will work to get an answer to you and we will communicate it to you. And so really, before I jump into any of the information I want to share, first and foremost, I just want to take the opportunity to extend my sincere thanks and express my incredible gratitude for the job that all of you guys are doing. I know I speak not just for myself, but for the City Council and really for the entire community, and just saying how proud we are of the job you guys are doing. We always talk about the role of emergency responders, even in normal times, but I want you guys to know that particularly in times of crisis like this, knowing you guys are out there on the front lines and serving your community, it's not only reassuring, but it's not enough to just say, well, I know that's the job you guys signed up for. You deserve, the special acknowledgement and need to hear how much we really appreciate everything that you guys are doing. Again, I know this has been I'm sure a challenging time for all of you, just given some of the concerns of who you're interacting with out in the public and whether they may be exposed to the virus. I know that this has impacts not just on your professional lives, but on your personal lives, impacts on your families. There are stresses involved, not just in worrying about what you might be bringing home, but whether, you have children at home and childcare issues that I know we all have to navigate with schools being closed. And so I hope you guys can hear from me and appreciate that we really are trying our best to balance your health and safety, doing what's best for you and for your family, with the need to keep the department running and operational at a time when the community needs us more than ever, or needs you more than ever. And so, to the degree we're not doing everything everyone would like, I just encourage you to try to keep some perspective that we are sincerely trying to do our best and do what's right for you, given a lot of the challenges that exist. And so with that, a couple questions I know that may come up that I'll provide an answer to, or actually maybe first I'll just provide a little update or briefing on from the community's perspective. I presume many of you have seen this information, but in the event you haven't, the county health department has been releasing or has created an interactive dashboard and is releasing updated information on positive test cases for the COVID-19 virus every day. Unfortunately, we have sort of the unenviable distinction of being at the top of the list for Lake County. I think as of this morning, we were up to about 30 to 34 confirmed positive cases. I don't have to tell this group probably that what we hear from our local health officials is that the number of actual cases out there is almost certainly much greater than the number of confirmed cases because of just a lack of available testing. And so I share that information with all of you just to remind you to please be safe when you're out in the field. I have full confidence in the job that Pete, Kevin, Mike, and all of your supervisory staff are doing to make sure you guys are well trained and well equipped out in the field and knowing how to interact with the public. But please be careful. It is clearly here in the community, the virus, and probably to a much greater degree than we even realize. One of the other issues we've been dealing with from the community, particularly on Wednesday, we had, I think, a bit of a rough day with the warm weather that we were experiencing. Not everybody has been practicing the appropriate social distancing that they should. Particularly, we've run into some issues down at the beach, out on the golf course, and at some of our city parks. Some of you may or may not have seen the mayor delivered a video address to the community yesterday that really was meant to serve as kind of a warning to everybody that if people could not start acting more responsibly, they were going to leave us no choice but to shut down the lakefront and all of our parks. And so no, we are going to continue to evaluate that in the next couple days. The message from the mayor, again, was meant to really serve as a final warning. We're fortunate that we've had, I guess, in this case, fortunate that we've had really lousy weather today, and it's supposed to be pretty crummy tomorrow too. But as the weather warms up, if we continue to experience problems, I want you guys to know that we won't hesitate to shut down access to our public places and begin more strict enforcement of making sure people are heeding those closures. So sort of with that in mind, I guess the only other thing I'd add from the community that, again, is not news to all of you, but I have been somewhat pleased to see that both on the police and fire side, that call volume seems to be, at worst flat and maybe even a little bit reduced. I know on one hand, keeping you guys busy helps the day go by quicker, but obviously, our goal is to try to limit your number of exposures to people who may be carrying this virus and trying to keep those EMS calls to other true emergencies. And I know that's a message that we've pushed out to the community very frequently. And a lot of credit to Pete for giving us the correct language to use on that. And it seems to be that people are listening. And so, I continue to get updates from the chief on what our daily call volume is, but it seems to be that the public is at least responding well to our message, not to call all of you guys out every time someone thinks they have a scratchy throat or a minor cough. So glad to see that. So with that in mind, a couple of the questions that I suspect would come fairly quickly that I'll just try to address early on. The most common that we've been getting is whether employees will continue to get paid during these emergency procedures that are in place. And the good news is that I can, communicate again and affirm, and really if there's one message any of you, that all of you take from this, is that yes, employees will continue to be paid. And in fact, we've modified our payroll procedures to ensure that part-time and overtime pay will be accounted for in the proper pay periods when that time is incurred or accrued. From my perspective, and again, I speak on behalf of the entire city council as well, it's the least we can do. You guys give so much back to our community. You serve our community, have served our community so well for years, and you continue to do so when we need you more than ever. Ensuring that you're getting paid in a timely fashion, so that if nothing else, that's one less source of anxiety that you have to worry about it, with all of the other personal and professional pressures. It's the least we can do for all of you. So if there are specific questions about payroll, I know we can get to those, but no, we will continue to pay our employees, and at this point that will continue for as long as this goes on. And I'd say as a credit to those that have come before me, certainly to our finance department, our department heads, and all of you that help participate in the budget process. I know sometimes it can be a frustrating process, and quite frankly, myself, my office, we're routinely accused of being pretty cheap, and sometimes there's some truth to that, but there's also benefits to that. And I think through a lot of strong financial management over the years, we've allowed ourselves to maintain, healthy reserves that give us the flexibility to weather these type of storms and to utilize those rainy day funds to make sure we can continue to take care of our employees first and foremost. Another question that I know may not be as pertinent to this department, but I'm going to discuss it because it's asked almost everywhere else, is how long are these sort of emergency procedures going to continue to be in place? The unfortunate answer is we don't really know the answer to that question yet. For the most part, we are not only following the lead of the governor in, supporting the shelter in place or stay at home order that he executed, but we're also relying on the opinion of our local health officials. And so at this point, we are maintaining consistency with the governor's message to keep the shelter in place provisions in effect through April 7th. We'll be reevaluating that next week. My sense to share with you is that it is certainly going to extend beyond April 7th. At some point, we'll probably need to start having the conversation as an organization about what we may be able to do to start slowly ramping back up some of our service provision. I know I'm mindful of some areas of the organization where people have a lot of anxiety about the accumulating backlog of work. And so, thinking through creatively different ways we could try to open in limited capacities, but certainly, ensuring that it's done in a safe manner is something we'll continue to reassess. But certainly I need all of the employees to know that in thinking through any future changes to the protocols we have in place now, first and foremost, those decisions will be driven by ensuring the health and safety of our employees. We are not going to do anything that puts our employees at an increased risk for not only their health, but ultimately that of their families as well. And we also have our role and obligation in a broader societal sense to discourage the public from gathering together. And so keeping our buildings closed is serving an important role in that capacity. So with that, maybe the only other thing I would note is one of the questions I've received from a bunch of other departments is about school closures. We do not have any additional information at this point about when Lake Forest schools may be reopening. What we're hearing is that it's going to be a while. They may not have announced anything beyond April 7th yet, but there should be every expectation it's going to be longer than that, at least probably through late April. That again is a decision specific to Lake Forest School. So for those of you who live in other communities and who may have children in school, I assume and will encourage you to remain in contact with your local schools for more information, and I'm sure you are. I'm sure, like me, those of you with younger children are going crazy and are ready to get your kids back in school. So we will hope for the best on that. But certainly, as we have more information, we will share with you. So with that, I'm going to see Pete Deshay. Is there anything you want to add before I open it up to Q&A for the audience here?
Sure. Just hello, everybody. Thank you for attending, taking the time to attend today. And again, thank you for continuing to keep the department running and everything you do. I just echo Jason's remarks in that regard. I know that there's some question. I'm just going to jump right in here on it about the Family First, the FFCRA, Families First Coronavirus Recruit, whatever. Sorry, it's been a long day. That's why we call it FFCRA. Response Act, there you go. And the fact that the city is allowed to exempt or exclude certain first responders, emergency responders. And at this point, we do intend to do that. However, the chief and I have been talking regularly about some ways we might be able to help some of your situations. And I talked with Mike Mounts today, and I know I don't have an exact answer for you yet, but we're looking at some things that might help, and we'll sort of take it from there. But know that we are not forgetting about you. We've got to keep the department running. And I know that Pete and Kevin and Mike have been working tirelessly to look at all different scenarios to keep you guys as safe as possible. So while I can't give you anything specific right now, know that we are constantly talking about it and looking for options out there where we can help you. I would encourage you to go on to the www.citylf.org. And I say the W's because I know from certain devices, you do need to actually type the W's in or it won't come up. There's a ton of information on there. There's a bunch of Q&As. The blog site is how we push out new information. Some of you, we uploaded all of your city email addresses into the system. I know Amber's been working on it. It worked great the first day. Every time we post something new, it would push it out to all of you so you'd know there was something new there. Having a few glitches since then, so I know she's gonna work on that. But check back there, that's how we're gonna communicate with you. New information. I've got tons of stuff that we've been gathering even today, even though we're doing all these work group meetings, to put on there sometime early next week. And so please check back there. If you have things that you think should be on there, please send them to me and we'll get them posted on there. They might help others. So again, just thank you very much and keep checking back. And the other thing about the website is under the blog site, if you wanted to enter your personal email versus your city email, you certainly can do that, put that in there as well. So thank you.
Pete, anything you want to add?
Yeah, just real quick, I think maybe save time more for the questions here, but echo a lot of what Deshay and Jason had just said. Very proud of the way you guys have been handling yourselves. And I think we just come to accept that we're going to answer the call, but this is definitely some unique situations for us. Your guys' safety has been my utmost priority. And you just know that a lot of this stuff like will come up today is that there's no one size fits all answer for everybody's situation and for the ever changing environment. I'm relying heavily on our medical officers and the EMS coordinators and Dr. Peters over at Lake Forest Hospital for a lot of their guidance in how we handle certain things. And they've been made themselves available 24/7. I appreciate their advice. As Deshay said, I've been speaking with her about all kinds of options. I've been in regular contact with President Mounts of the local. We'll do whatever we can to get through this. I know some things, some answers are going to be hard for people to take, and it's not going to fit everybody's life or to their liking, but we're doing our best to try to take care of people, and also keep providing the service that we're dedicated to do. So thank you for that. And thanks again for your patience with all of the station construction that couldn't have come at a worse time. But I'm really impressed the way people have just rose up and got the job done, and very proud of that.
Great. So at this time, we're happy to answer any questions that you guys have. So Joe, Amber, if you maybe want to explain again how they can answer the questions, and then Amber, if you want to read them to us, we will do our best to answer.
Yeah, sounds good. So again, the Q&A button is what you want to select if you want to ask the panel any questions whatsoever. You do have the opportunity to answer those or ask those anonymously. Q&A button is located either at the bottom of your screen for Windows computers or the web browser. Those on smartphones, iPads, those will be at the top. Just press those and Amber will queue those up. With that, I'll turn it over to Amber for the questions.
Okay, first question. According to Mr. Wish's email on 3/13 entitled COVID-19 Response and Update, if you are identified as emergency personnel, please contact your supervisor before reporting to work if you have childcare issues due to school closings. If my wife and I are both considered essential personnel in the healthcare industry and my sole childcare providers are in an at-risk population told to stay at home, will my absences be excused?
Do you want me to take that one, Deshay? All right. Yeah, we've had a couple of situations with this, and unfortunately, right now we're kind of in limbo of this, the FFCRA being enacted, and even if it is enacted, and the city then excludes emergency workers, it might not apply. We do have certain things right now that we have to follow our contract to what sick time qualifies for, and unfortunately, right now, healthcare, childcare of a healthy child does not fall under that. As Deshay said, we're working on some options that we can try to present to people. I've also been on several websites that have some options for emergency childcare that, with so many people out of work, the state has put up a good website that if you didn't have childcare, that they could direct you to places and facilities in there, which I'm going to share with everyone after this meeting. So as I said before, it's case-by-case basis with this. We're trying to work through people with what types of leaves they have available, and we'll try to navigate through this in the weeks to come here and make sure that we can balance people's needs with staffing the station.
Yeah.
Right, and the other thing that I failed to point out was the FFCRA doesn't even go into effect until April 1st. So until that time, everything is under the regular CDA and personnel policies.
Yeah, and I was just going to say that in acknowledgement to the memo that was referenced, I mean, one of the reasons we're finding this to be a much more useful tool in communicating with all of you is because, again, for better or worse, not all policies can be one size fits all across the entire organization. And a good lesson learned for me too in trying to communicate the right thing, but perhaps just creating more confusion than anything. That was certainly not the intent. And so again, I can only echo. I'll say I rely on Pete and Deshay's recommendations as to what the best course of action is, but certainly the direction I provide to them too is just, echoing what Pete said, that we are doing our best to try to balance your, family and health needs with the need to keep, the department operational and the stations fully staffed.
Okay, next question. First off, thank you for fielding our questions and hearing our concerns. The AFFI has taken the stance that anybody who is sickened with COVID-19, it should be considered an on-duty illness and treated as such, i.e. workers' comp. After listening to our mayor address the city of Lake Forest and hearing that the city was told by Northwestern Lake Forest Hospital that hundreds of Lake Foresters who are carrying this virus are contagious and do not know it because they have not yet developed any symptoms, What is the official stance of the city regarding FD personnel who will inevitably contract this virus at some point?
I'll take that one. If you go on our website, under the FAQs, there is a question about this that addresses this. This is a response directly from IRMA, and they will be taking things on a case-by-case basis. Obviously, you guys are at a higher risk. So most likely, I can't say in every case, but most likely it would be considered a workers' comp claim. Therefore, and I'm glad the AFFI considers it basically presumptive, but that's, that goes beyond what we can do. So again, there is a response on the website from IRMA, and most likely it would be, but they're going to look at all, they're going to ask you for all the circumstances around it. So just like they would with any other workers' comp injury.
Okay, next up. If I am in contact at home with a healthcare provider who is treating confirmed positive COVID patients, should I report to work? Further, if I am at home with someone in quarantine, should I report to work?
Pete, I'm going to let you take that one.
The quarantine part of that is, I have not run into that one yet, but we have had people that work with positive patients, but just like we're treating it, that if we're wearing the proper PPE, we're not considering that an exposure. And my direction from the medical director over at Lake Forest Hospital has been, if our workers are not symptomatic and their spouses who are working with them are not symptomatic, that we're going to keep reporting to work and we're going to monitor. If that changes, we're taking steps to monitor everybody every day and hope people are self-monitoring. If anybody runs into that situation where they have someone quarantined, we'll have to deal with that on a one-on-one basis and go from there.
Okay, next question. Are all vehicles going to be fully disinfected before going to fleet for repair or services?
Good question. Pete, you want to take that?
Yeah, I mean, anytime we have any suspected call, we're doing regular cleaning on the vehicles every day. So we're doing our wipe downs, and if there was an exposure call that we were a high risk patient, we would definitely do a deeper cleaning. So to the extent we can, that we're cleaning it for our own personnel, the vehicles should go up there clean. If we get a case where we have a breakdown during the middle of a call, then we can make an extra effort for that. I will definitely make note of that. That's a good thing to look at.
Okay. Next question. Why are other city employees sitting at home getting paid, yet when we attempt to get help with sick time, the city doesn't have an answer?
Well, I'm not sure what you mean about getting help with sick time. As far as, that's kind of a broad question. I'm not quite sure how to address it. We do allow you to have sick time if you're sick. I think if the issue is the childcare issue, we're trying to find some alternatives and provide you with alternatives. But I guess I need a little more clarity on the question to really delve into it too deeply.
And I'll just add too that I am sensitive to the fact that for some of our frontline emergency responders, there is a feeling or sense of inequity in terms of what is being asked of you versus others. And just know that unfortunately, again, there is no one size fits all solution here. We are trying to do what we think is right for all of our employees and all of our departments, while also maintaining the emergency operations that we need to. You guys understand that you're in a bit of a different situation with, minimum staffing and some requirements that other non-emergency departments don't have. And so, there are some departments that, yes, we have the ability to close to the public at least in terms of a public interface, I can tell you that to the degree there's a sense that there's a lot of people just sitting at home. There are an enormous number of fellow employees in the organization who are doing a lot of work remotely, and in many cases are working more hours, from home than they may have before. But again, we're not perfect, but we are sincerely trying to do what we think is best for everybody and trying to take care of all our employees while balancing that again with the need to maintain our operations.
This came in as a secondary to a question, but it doesn't say which. Also, why was the blog changed?
I don't quite understand what was.
From the employee website.
Perhaps somebody could go in again and maybe clarify that position. I'd be happy to follow up with that one.
Yeah, thank you.
Okay, next question. If we are considered the epicenter of this virus for Lake County, like the mayor stated, why is the mayor not mandating a complete shutdown of the public in Lake Forest already?
That's a fair question. I understand why it's asked. I think the sense from the mayor and the council was that it wasn't until Wednesday that we saw pretty blatant disregard for social distancing. And so rather than make the immediate step to just say, all right, we're closing everything, the decision was made to, in essence, give the public one last chance to act responsibly about it. The hope is certainly that the residents of Lake Forest know what the right thing is and are capable of acting responsibly. But as I said to you before, in the event we see a repeat of Wednesday, then we will certainly shut our parks down. We'll never have a complete shutdown in the sense that people still need to be able to go to the grocery store, but assuming that is meant more for public spaces, again, I think we're close to being there. And if we see a repeat of what we saw the other day, then we're going to end up closing them down.
Okay, next question. State of emergency and emergency procedures phrases have been used. Do you differentiate or do you think of them as one and the same? If so, at what point is a state of emergency declared?
So I guess, I can let Pete refer to it maybe specific to the department, but I will say in terms of the state of emergency declarations, if it's in the context of what some of you have seen other municipalities, city councils, village boards do, the reality is that a lot of the emergency procedures that they are granting themselves in these declarations, Lake Forest already has contained within our codes. So for us, the sense has been at this point that it didn't require specific city council action because again, we already have a lot of those broad authorities. Certainly as it pertains to, individual operational issues, myself, Pete, have the ability to make those declarations. And Pete, I don't know if you want to speak to anything specific on your end.
Yes, I hope everybody got my email about kind of the status that we may need to go there. I've been kind of holding off. I do have an emergency, civil emergency declaration ready, similar to what the police did. The police were forced to kind of move forward with that because of some of the shelter in place orders and the difference in their enforcement. I'm hesitant to do ours right away just because it does take away some of the all of the assumptions and the clauses of the union contract. I'm kind of sensitive to that, but there are also some avenues of it that could free up some flexibility to do some other things. So I'm balancing that and watching the situation and hoping that everyone knows that I could enact that at any time. And that one of the major things on that would be, a significant hit to our workforce and the ability to take away or recant back time off. And right now, I think people need time off with the stress level at the job. So I'm encouraging people to use their time off as it is now. But I am ready with that declaration. I've talked with it at great length with President Mounts. I've talked over with Jason. Everybody's on board with it. But at this point, I don't see a need to put it into play yet, but I am ready at a moment's notice to put it into play.
Okay, next question. As first responders, we are on the front lines during this crisis, and we are the ones who put ourselves and our families at greatest risk. Can you please explain in detail why you would exempt first responders from the new act, and what specifically do you plan to do to protect your emergency responders?
Well, I think we've kind of addressed this a couple of times already, but we have to maintain, and I'll let the chief go into more detail on this, but it's a concern about maintaining the coverage and maintaining people at work. Like I said, we're looking at some alternatives to try and help, but we have to maintain the services.
Yeah, I think definitely a balancing act that we're trying to work with. As far as protecting, we're trying everything in our power to get as much protective equipment as we can. We keep securing more and just advising everybody. We've changed our protocols. We've changed our, how we respond on calls, what we're wearing as level of protection. We're coming up with contingency plans for other equipment if need be, and trying to make the station a little safer. If, even in state of disrepair, trying to worry about social distancing, monitoring our employees before they start work, and encouraging everyone to self-monitor. So again, it's just trying to make that balance of we can't have everybody off. We need to maintain people here, and if multiple people on a daily basis have to be out, we're going to have to fill that back in somehow. Or the next step is to then reduce staffing and try to run on contingency plans.
Okay, next question. Full and part-time employees will receive a paycheck with no impact on various leave banks from 3/18. It was then changed to full-time and part-time employees will receive a paycheck with no impact on your various leave banks unless you are sick. I believe this was an addendum to the blog question.
Right, and those FAQs that are on there, they will be updated as things progress, and that was an update. I mean, this is all a huge moving target, and we tried to get as much on there as we could immediately, but the executive staff meets every morning and goes through things and talks through things, and we're trying to figure out how things will progress and be fair and consistent. So yeah, those will be updated from time to time as we sort of make some decisions and try and figure things out as we move forward. So they do need to use sick leave if they're sick. And that's a decision that we as a staff came to. So that's why it was updated.
And I'd like to add to that too, and some of that was changed that I hesitated to give that announcement to people. There was talk of a flat check based on the last pay period. And I know some people rely on overtime, and I didn't want to have them to worry about that getting made up. So I really want to thank Finance and Elizabeth Holland for working through ways. We have Jamie working at home, entering payroll. So people are going to get their holidays and their overtime pay in this pay period instead of a flat check that was based off of your salary. So it wasn't done to slight anyone. In fact, it was done to help the police and fire people who are out there actually actively working and getting their pay. So I'm very pleased with that.
Okay, one more question. My phone is cut in and out, and so I'm sorry if this has been asked, but would we reduce staffing before hiring back overtime?
I think that's all going to depend on the current situation on there, where the reduction of staff, in my mind, is if we have people that are positive tests and need to be quarantined, that we've got contingency plans in place on how we would roll that out and change our shift dynamics. I think we've already seen some dynamics that we're trying to keep people at different stations. So, that's our main goal, is trying to keep as many people as we can here to get the mission complete. So we've been lucky. It's been slow. And I think we're all just kind of waiting for the other shoe to drop, or to see something like Chicago or New York. I hope that doesn't happen. But if we get overrun and we start losing our manpower, then that's when the emergency declaration comes in and we might have to cancel time off. Again, I'm very cognizant of people's time off, and I want people to take their time off right now and be able to try to relax and de-stress from this place. So those are all moving targets. Again, it's just how that situation unfolds.
Okay, next question. With all due respect, you didn't answer my question about the act. Why specifically, after Jason sent an email saying he would take care of all employees, would you choose to exclude employees from the act? We are your frontline barrier to this crisis. We are the ones who put our lives and our families' lives at risk by coming to work. We are the ones, some of us are considered higher risk to begin with, that risk our lives every day for all the residents.
Well, first of all, we have not made a decision whether we're excluding or we're not, but we are considering, and I'm going to be honest with you about that. And I don't know how much more to say this, that we have to maintain coverage. So that's why there's a reason that was allowed in the act, so I don't know, Pete, if you want to go into it in more detail, or Jason, you want to say more, go ahead.
I'm not going to comment on the act, but just to kind of also circle back on the last one, as far as like hiring back overtime, we're committed to staying at our staffing of 8 so we can try to keep our people safe. So we are going to hire back overtime, until the situation would get so desperate that we don't have people to fill those spots, and that's when we would scale back. But we've been committed to staying at our minimum staffing of 8, and we're going to continue to do so as long as we possibly can. That is a big goal of mine.
Yeah, and again, I don't think I really have much more to add other than saying again that we're trying to balance what's doing best for you and your families with the need to keep operations going and to keep our staffing levels so that we can continue to serve the community. And I appreciate that there may not be a perfect solution to it, but I also appreciate the chief taking seriously, the obligations that we have to the community. And again, I think to his credit and to Deshaies, because they've been working closely on it, I know that they've been trying to strike that right balance. And so we're doing our best. And again, I know no decision has been made yet, but I will just echo Deshaies' comments on it.
Okay, next question. Is the city prepared to help an employee that tests positive and doesn't want to return home for the quarantine? Example, a hotel stay.
Pete, why don't you answer that? Because I know you've been working on that.
Yes, I have several things in the works right now. I actually have some hotel providers that are giving me discounted rates, and we're going to do whatever we can to work with somebody. I hope it's been communicated that our short-term plan is, if we had anybody with a positive test or an issue that we could not bring them back to the station, the Croya Center over at the rec center is kind of our intermediate stay, and if need be, it can become a housing in the meantime. But I'm also working with several other agencies to secure some housing resources. I have 3 or 4 options online. So we will work with people. We will take care of people, and unless we get inundated, with multiple people, we'll do whatever we can. I do have some flexibility and have been dealing with some people in town that I think we can accommodate everyone.
Okay, so that is the end of the questions at the moment.
Well, if there are no other questions, I guess I would just say a couple of things again. First, thank you everyone for your time. You know, it is good. I'm not as, you know, connected to you guys on a day-to-day basis as the chief obviously is, or even Deshay, but it's really helpful for me to hear your perspectives and to hear your concerns. I can only emphasize again that we're trying to find the right balance here. And we do want to do what's right for all of you. And, you know, I hear your frustrations. You know, again, will expect that you'll continue to share those with your supervisors, with the chief, and we'll all continue to communicate to find the best solution that works for everybody. So thank you guys very much for your time today. Thank you again for all that you're doing on a daily basis. I can only echo and agree with all of the comments all of you made about being on the front lines of this and putting yourself at risk. There's no question you guys, you know, are proving, you know, your value to the organization, to the community every single day. You continue to do what you're doing, and we're all just incredibly grateful for all of it. So thank you very much. I hope you take some time to also care for yourself mentally and physically, as the chief alluded to. There's no question that these are stressful times and produce a lot of anxiety for everybody. Your mental and physical well-being is more important than anything. So I hope you can find the time, whether it's, you know, on shift at home, to exercise, to find anything that allows you to relax a bit, because it is really critical. So thank you guys again for everything you're doing, and otherwise we'll continue to be in touch. Pete, Deshay, anything you want to add?
Yeah, I just put up, you know, my usual offer that I'm always available to talk to people. I might not have the answer that you're going to like to hear, but I'm willing to work with people and talk to people. I've been very appreciative of some people that have come just to talk to me face to face or call me on the phone. I am approachable. I've tried to always be that way. And just like Jason, I'm extremely proud of the job you guys continue to do. I continue to hear great things and get great compliments, and you know, I expect nothing less, and you guys always rise to the level, and I appreciate it.
I think we had another question come in.
Yes, that is correct. With no FFCRA final decision being made, can you include the union in those talks?
I think that this is really a top level decision. However, I know Pete has been in contact with your union leadership. I think we know where you stand, and that's all going to be taken into consideration. It's a balancing act. That's just my gut reaction. I'll let Jason and Pete jump in there.
Yeah, really, I would defer to the chief on that.
Yeah, I continue. I'm keeping in constant communication with Mike on stuff like this, and you know, I will definitely consult him. And some of this stuff, like I said, is a city decision, but I've been taking all the input he's given me, and I'm willing to always listen to any kind of ideas he may have. So I hope people know that I always keep an open mind, but at the end of the day, the decision is going to lie within the city's parameters to the way that we go with this decision.
Okay, that does look like the extent of the questions.
Great. Well, again, thank you everyone for your time. And the only thing I would ask, if you want to send an email either to Joe Gabansky or just pass along any message to the chief, if you guys find this useful, if this is something that you think was a good use of your time and would like to see these continue, please let us know. Because again, we're trying new things to ensure we can communicate with all of you, answer whatever questions you have, but we also want to be meaningful of, respectful of people's time. So if you think these are helpful and you want to see them continue, please pass that message along. If not, then please, let us know that as well.
Yeah, thank you, everybody, for your time, for paying attention, for your thoughtful questions. They weren't easy questions, I'm not going to lie, but we appreciate it. We like to hear from you, and we don't always agree, but we do like to hear from you and appreciate your feedback. So thank you.
Just had another question. The Lake County Department of Health just confirmed 222 cases in Lake County out of 703,000 residents. 703,000 residents. Is there a process the city is exploring to test first responders to help identify who may be currently affected by public or private means? Obviously, this is dependent on availability.
Pete, that's got to be you.
I'm not aware of any plan right now. As I said, when I talked to Dr. Peters and to Everett, that they are not in fans of testing people that aren't symptomatic and using, I'm going by their recommendation. There are places out there that allow tests for first responders. If people want to get tested, then that's on them. I don't, at this point, I'm just going by the recommendation of our medical system that they're not recommending we get tested.
Are you guys you're checking temps though, right?
Yes, daily.
Okay, no more questions at this point.
Great. Well, thanks everybody again for your time, and we look forward to seeing you again soon, and keep up the great work.
Thank you.
Thanks.